Live from KTV in Reno, you're watching 2 News at 6:30.
I would not mess around with this one. It's an unpleasant way to go.
Health officials are warning people about rodent infestations after a South Reno resident tested positive for hantavirus. And that is our 2 News big story at 6:30. This is the first confirmed case of hantavirus since 2 cases were reported back in 2017. I'm Kristen Remington.
I'm Ryan Canada. Thanks for joining us tonight. Luckily, the patient is out of the hospital after recovering from the virus. Paul Nelson joins us now live in the studio. So, Paul, how can people protect themselves from this virus?
Well, Ryan, if you're cleaning out your garage or shed, keep an eye out for rodent infestations or mouse droppings. Hantavirus is a rare respiratory disease that can be fatal, and the most common carrier is the deer mouse. So if you have a rodent problem, it's best to take care of it and plug the openings where mice are getting in.
The larger stations, we use them on the outside.
Kristen Moreno is a technician for Pest Control. He comes across a lot of different rodents in his line of work, including deer mice.
The deer mice, they're pretty active all around. Specifically in an area like this where we live in the desert.
They will have white, furry underside.
Deer mice can carry the hantavirus. People can get infected after breathing or touching viral particles in the mouse droppings, saliva, and urine.
I've had people ask, well, how do I know if it's deer mouse droppings versus other kinds of droppings? And the answer is you don't. Avoid all rodent droppings.
People should not vacuum or sweep up droppings. Instead, they should use wet cleanup methods.
We definitely would recommend, if you are planning on cleaning, bleach, water, mask, gloves, and let it settle, and that'll kill the virus.
Experts say people with rodent infestations in their homes have the greatest risk for infection. Hikers and campers could also be at higher risk, especially in infested barns or cabins. Hantavirus has several symptoms, including fever, headache, abdominal pain, and vomiting.
It's important that if people have been exposed to rodents and they feel themselves coming down with symptoms that could be hantavirus, that they seek medical care.
There's no specific treatment for the virus, but that medical treatment could keep infected patients alive.
It's now recognized earlier, and people get supportive care, and they don't die as frequently as they did a few years back.
Symptoms can develop anywhere from a few days to 6 weeks after exposure. Shortness of breath, fluid buildup in the lungs, and other late symptoms can happen 4 to 10 days after the initial symptoms. Covering the story live in the studio, Paul Nelson, 2 News.
All right, Paul.